Hi, good afternoon, everybody. Thank you for being here this afternoon. When the governor introduced the FY18 budget, he said we didn't like the way it looked, and that in order to do what we're presently doing this year, to provide a small boost to education, we needed $440 million additional dollars. For that to happen, we would need either a bump in the Revenue Estimating Conference forecast or revenue from some of the many tax options that are on the table. REC is going to meet later this month, but at this point, no session measures have advanced very far in the process. Yesterday, the House Appropriations Committee took the first step, or should I say misstep, in the budget process. The bill awaiting action on the House floor is a non-starter for a variety of reasons that we want to outline for you today. First and most obvious, it leaves $237 million of revenue recognized by REC on the table. The governor has stated his support for not using every available dollar in the budget process, but only after we stabilize the budget with meaningful tax reforms, preferably as recommended by the task force. Secondly, the bill cuts an unspecified $155 million from LDH, plus an additional unspecified $81 million from LDH, the latter specifically to fully fund TOPS. This is a minimum of $750 million that will be cut out of the LDH budget when you factor in the federal match. The governor has repeatedly stated his hope and his intent to fully fund TOPS with the first dollar of additional revenue. He's also stated his unwillingness to reach full funding for TOPS at the expense of health care for Louisiana's most vulnerable citizens. The committee yesterday, as it has done in the past, refuses to take any responsibility for making specific cuts. Instead, the amendments virtually authorize and direct, or literally authorize and direct, the Commissioner of Administration to make the cuts, while at the same time limiting the options that are available to make the cuts. For example, the public-private partner hospitals remain cut at 6% as originally proposed in the governor's budget. The committee specifies that they can be cut no further. The committee also directs that all cuts to hospitals must be made on a pro rata basis. Now, all these hospitals have unique contractual arrangements with the state and different funding mechanisms that may not lend themselves to the pro rata cuts based upon the dollars available and the services that each provides. The committee amendments specify that no reduction can be made to graduate medical education. Such funding is driven by the arrangements with each private partner. So the committee specifies that cuts must be made on a pro rata basis, but the graduate education cannot be touched. The administration has no intent of cutting graduate medical education, but the language itself creates an inherent conflict. LDH cannot reduce waiver services, nor can they reduce funding for the applied behavior analysis rates. LDH is further limited by removing language in the bill that would allow LDH to move money around in order to address budget shortfalls in one area by pooling excess receipts from another area. This is a process that has long been used to cope with the challenges of operating a $14 billion budget. LDH is put in a position of having to intentionally, potentially not pay the 13th payment, $146 million, to medical vendors, or make even more draconian cuts than will be outlined by Secretary Gee momentarily. The 13th payment, as you recall, is another legacy of the Jindal administration, which the governor and legislature reluctantly agreed to carry over into the 18 budget in the wake of the 17 budget shortfall. It's one thing not to make this payment when budget cuts are necessary and decisions are made as to what will and will not be funded. It's an entirely different proposition to intentionally exclude this funding from the budget at the beginning of the year. Nevertheless, the choices available to LDH under the committee amendments will force this choice to be made. All departments, not just LDH, must first eliminate funding for vacant positions. In essence, this means that whatever vacancies exist at the beginning of the fiscal year, a point in time that will be frozen, those vacancies can never be filled during the year. Despite the importance of the vacancy created for whatever reason, retirement, termination, promotion, no one could be hired, period. Imagine the consequences of that micromanagement if you're trying to run the Department of Health, you're trying to run the Department of Corrections, you're trying to run any agency of state government, and a vacancy is created and simply cannot be filled because the legislature has dictated that you can't fill that position. The Department of Corrections and the Department of Children and Family Services are arbitrarily reduced by $10.6 million and $19.5 million respectively. All of these reductions were made with absolutely no testimony from the departments or the public as to how these cuts would impact the delivery of services to the public. It's one of the reasons why we're here today, so you can hear what the impact is going to be on some of the departments that are hit most heavily. Instead, the amendments were made available late Sunday evening, discussed and voted upon with no testimony whatsoever, except that a representative of the Attorney General was called upon to speak at one point during the hearing. Now, there's several other committee amendments that are problematic that I want to just outline for you that don't directly impact the amount of dollars cut by a particular department. One of the few examples of specificity, the committee reduces the Department of Veterans Affairs by about $147,000. You'll hear what the consequences of that cut will be momentarily. Now, as I suggested to the committee, there is a significant difference between management and micromanagement. The legislature clearly has the prerogative to manage the budget by choosing to fund and choosing what not to fund. However, it does not have the prerogative to direct the executive branch of government in the administration of dollars appropriated by the legislature. The committee seeks to overstep that authority by requiring joint legislative committee on the budget approval of any change to the allocation of expenditures set forth in the budget. This potentially will grind the wheels of government to a halt at the time between each monthly meeting of the Joint Legislative Committee on the Budget by not allowing the agency heads to manage the dollars that have already been appropriated by the legislature. In other words, money cannot be redirected unless and until approved by the JLCB at its monthly meeting. We estimate that there could be as many as hundreds of expenditure adjustments that would have to be considered by the JLCB if this amendment became a part of the budget process. One committee amendment seemingly violates the well-recognized Supreme Court decision of Henry versus Edwards by seeking to include a substantive change in the appropriations bill. You can't change substantive law in the bill. The amendment specifies that no funds may be used for performance adjustments or salary adjustments in accordance with a compensation plan that may be approved by the Civil Service Commission. This may violate the Commission's authority to regulate such employee matters and raises constitutional questions as well as separation of powers questions. Another amendment seeks to move money from the CDBG Homeowners Fund to provide funding for the Comey Diversion Canal, a greatly needed project in Louisiana, but this is a capital outlay expenditure, not an HB1 expenditure. And more importantly, if that amendment became law, it would potentially deprive 4,000 or so homeowners who've been ravaged by the recent floods from receiving the money that's been designated by Congress for that purpose. So I hope you can see from this cursory look at the budget the problems it creates. To give you an idea of the specific problems that will be faced by the various agencies, we've got some folks here who are going to give you some details, and we'll start with Secretary Gee.
Good afternoon, everyone. Remember that these cuts come on top of successive years, 8 years of the prior administration, of cuts to my department, which left us with half the number of employees and less funds than we had ever had historically to run operations. And on top of the $90 million of unfunded priorities that were very important priorities, such as fully funding managed care, making sure that we could pay home and community-based providers, and ensuring that physicians were paid fair rates for services. These cuts are at the very least $750 million to our programs and would affect the health and safety of every Louisianian. Highlights among these are ending access to coverage of pharmaceuticals for adults. These would be all the adults in the Medicaid expansion population. And who could imagine doing a heart transplant or a kidney transplant and not providing any pharmaceuticals? It's something that we wouldn't even want to contemplate and is foolhardy from a medical perspective and a public health perspective. And would affect over 600,000 people in the Medicaid program. Elimination of over 120 inpatient psych beds, devastating access on the North Shore and Lake Charles and the greater New Orleans area, The cuts will likely force patients in acute crisis onto the streets and away from the care they desperately need, and into likely jails and other areas where we're trying to make a significant impact to decrease the overall burden for our state. We force noncompliance with federal orders, risking legal sanction to the state. This would force us into noncompliance and a DOJ concern regarding our nursing homes and our ELMS facility and the resources that we need to appropriately populate and staff those facilities and ensure that people are getting safe and adequate care. Dropping our Zika defenses. We are blessed that we did not have local Zika transmission last summer, but because of our climate and the likelihood of the fact that there will eventually be transmission, we would have to end all of our funding for the Zika response. It's estimated by the CDC that every baby, and it's a substantial number of babies who are infected with Zika, who get microcephaly will cost $10 million. This is just unfathomable and would affect the public health of everyone in this state. Ending local services, so we would have to cancel all of our programs, school-based health, clinical and access-oriented services, including behavioral and substance abuse health services. These would impact more than 135,000 residents through $70 million reduction to the DISH-LINCA contracts. And that would obviously end not just that funding, but the additional federal funding that comes with the state investment in those areas. The staffing eliminations that Commissioner Dardenne spoke about are of enormous consequence to our department. Imagine running a facility where you can't, if someone retires or takes a new job, you can't fill a position. Who's going to take care of patients if you don't have nurses? Who's going to make sure that the staff are safe at Pinecrest? In ELMS, we already have over 90 employees worth of overtime hours of the people that are working there. We're working them to the bone. They're overstretched as it is. So imagine not being able to fill those important positions. It's irresponsible. And there's a lot of talk about the cuts being fake or phony, and this notion that the budget can just take it, but I would challenge you to ask our medical schools and their faculty about these cuts that were real and after the second mid-year reduction. Last year we had the escape parachute and the cushion of Medicaid expansion. We were fortunate to have a very effective implementation and a high number of enrollees that allowed us to have managed care dollars and other federal funds that helped buffer the impact of a budget cut to my department. But these dollars are no more. We had this shift last year. We've enrolled the individuals, over 420,000. It's been a godsend for our state, but we don't have that escape parachute now. We've got to deal with reality. And so you don't like this reality. So as we have had an exercise in the past of going through these programs, and legislators say, well, why don't you look at your other programs? Well, I'll tell you what's on that list. And again, on our list, in addition to the cuts I described, are the elimination of the psychosocial rehab program. The legislature did not allow us to eliminate that, but the message they'll give the public is, oh, the department can just go eliminate programs, but when it comes to the hard choice of what program to eliminate, they refuse to make a decision and they refuse to take a stand. So unfortunately, though, we would have to eliminate pediatric day health, psychosocial rehab for youth, and virtually all behavioral health services in a state that is already compromised in its ability to take care of the mental health needs of its people. And if you don't like that list, it's the consequences of other options are worse, because at this number of $750 million, there just isn't funny money or fluff money or anything hiding in any corner of our department, because I assure you we have looked at that and we made cuts of over $50 million to our program offices and other areas of administration last year. So these are eliminating, the other options would be eliminating long-term personal care services, eliminating the PACE program. This is a program that allows elderly people to stay in their homes to get food and sustenance and care. Eliminating the ICFDD. These are facilities for the developmentally disabled that are lifesavers for families. Eliminating physical and occupational therapies. Eliminating case management. Elimination of the hospice program for individuals who are dying and need respite, solace, and comfort. Eliminating the ambulatory surgical center program so that people couldn't get colonoscopies, they couldn't get procedures in any setting other than an inpatient hospital. Eliminating hemodialysis and eliminating inpatient mental health services. So I assure you, these are all the choices available to us at these level of cuts, and they are all unacceptable, and they affect the 4.6 million people of our state in ways that we feel are irresponsible, and surely better solutions can be found.
We'll be happy to answer questions when everyone's completed their remarks. Next is Marquita Walters from DCFS.
Good afternoon. When Dr. Gee talks about reductions of behavioral health, I want you to remember that many of the children that she serves are foster children in our system. And my main concern with this budget is the lack of understanding of the fragile families that are being affected by these cuts. We have over 8,000 children that pass through the foster care system each year. We serve over 900,000 families with food benefits that are 100% federal dollars that bring billions into our state through grocery stores and places that sell food that would just be cut because we can't afford to run the program when we keep reducing the staff. We are already on an intervention with the feds with our food stamp program. We're already at the edge of not being able to sustain this program. One of the amendments takes away my authority to prioritize funding in the way we believe is the best thing for this state. We have said for 15 months since we walked in this door that the child welfare system was fragile and very nearly broken, and that we were going to shore it up and protect it from further cuts. And the governor and the commissioner have worked diligently with us through all these budget cycles to make sure that we didn't hurt child welfare. But this amendment will strip away 67 positions in child welfare. It doesn't even give me the authority to run the agency to follow the priorities that we have set as the most valuable and the ones most vulnerable. Because when you are the custodian and you are the parent of a child, which we are in this state, when a child enters foster care, you do everything you can for them. And when they need behavioral health services that aren't available, where are we to turn if those services are stripped for the most vulnerable children that we have taken through no fault of their own? These are children that have been abused and are victims. They are not children that are out committing crimes. And so the lack of understanding and compassion about our most vulnerable families is greatly disturbing to me. And as Rebecca also said, it doesn't take into effect the year upon year upon year of cuts. I walked into an office that was 2,000 people less than when I left in the Blanco years. 2,000 people less, half the budget, with the same number of services and growing to be delivered each year. So these cuts are draconian, and they're not even sensical. The biggest chunk of money in our particular cuts, in the 19 million, which by the way is 70 million in federal when you add my federal match. So you can say it's a $19 million cut, but what I really deal with is $70 million in DCFS money that won't be there. And so when we look at that, the biggest chunk of it was in an investment to try to shore up our legacy systems in technology. We have systems that are 35 years old. How many of you are willing to work on a computer that is 35 years old? That's older than many of you. We have 5 legacy systems in the child welfare arena alone that workers have to come back in after a day out in the field and enter duplicate data into multiple systems because the systems don't talk to each other. So our attempt to try to do an integrated system and build a Saquiceva system for child welfare, which is the federal name for what we need, is stripped away in this budget cut. I am concerned deeply that the cars that were cut, over 70% of our fleet has over 170,000 miles on it. These aren't cars that I'm driving around town to visit in. These are social workers driving to remove children from homes, to take them to therapy appointments, to take them to school, to take them to visit siblings that might be placed somewhere else or to visit their birth parent. We're transporting fragile children. And when you break down on the side of the road with an infant in our heat in the summer, that's a pretty dramatic and traumatic experience that our workers should not have to endure. The lack of compassion in this budget is appalling. Thank you.
Thanks, Marquita. Jimmy LeBlanc, Department of Corrections.
Good afternoon, everybody. I feel like Rebecca and Marquita that, you know, we started with $180 million less and almost 2,000 positions less. And of course, I've been secretary for 8 years. I've been through those cuts and have experienced those cuts. And, you know, to continue on that road is to me, a public safety issue for not only our employees, but the public. So let me kind of put things, the big picture for us is that currently, and we've been upfront about this, our department is projecting current year $12 million deficit. Current year $12 million deficit. And of course, we're working with the governor and commissioner to help out with that. And then initially, you know, we had 2% in the executive budget, which is about $9.7 million. And then, of course, the House Appropriation Committee added $10.6 million to that. So, you know, when you pull all that together, that's $32.3 million that on July 1st that this department is faced with. And as we've said in committee, you know, many times, we have one correctional officer with 170 inmates at Angola in the evening times. Our correctional officer to inmate ratio is well above what it should be in this country. And I just want to make emphasis of that. And on top of all this, mandatory adjustments, and that was talked a little bit about in the appropriations report that I saw. And, you know, with risk management, with retirement increase for a big agency like corrections, a retirement increase for our retirees is huge. It's like $4.5 million. But when you, Office of Risk Management, Office of Technology Services, when you add all those into our budget, it's $9 million that's added to our budget. So, you know, it's kind of it's not a cut, but it kind of is a cut because those are big increases that it makes it look like. And over time, that's $160 million in our department over the last 9 years. So those adjustments makes it look like our department isn't participating in the budget cuts like the other agencies, bigger agencies in particular. So what does this latest mean for us? Where am I right now with budget cuts? And I know most of you are in touch with the task force, which I chairs with the Reinvestment Task Force, and we had a good morning this morning, I think, in 2C. We got 220, Senate Bill 220, 221, and 139 out of committee this morning, which is a step in the right direction. But I say that because investment is the key to this. Investment is the key to our department. If we don't begin to invest in the criminal justice system, we're going in the wrong direction. And to continue to cut is going in the wrong direction. So where am I with this? Give you an example, and I've already shared this with a few of you. You know, when we look at the cuts right now, I got to go to furlough inmates. And what I have to do is furlough inmates within their last 6 months, nonviolent, non-sex, that have to have a low-risk assessment, and furlough them. And roughly on July 1st, that number has to be 2,000 and then 250 a month for the next 11 months. And that's just something, and that amounts to about $8 million. So obviously it doesn't get us there. So what's next? Furloughs for our employees, for 1 day a week for all our non-security, non-medical, non-mental health. We would have to furlough our employees 1 day a week for a year. 1 day a pay period for a year. Vacancies. We have 235 vacancies in our department. 99% of those vacancies are turnover with correctional officers and probably medical staff. So what does that mean? So you take vacancies and money? Right now, when a correctional officer doesn't come to work in our department, we have to fill that post. We 24/7. We cannot not fill that post. So what does that mean? Overtime. So that's part of the projected deficit that we're faced with right now with these vacancies. We're trying to hire people every day. We're doing everything we can to promote, but at $23,000 a year, it's hard to do, and it's a very difficult situation. So let me back up a little bit here on employee furloughs. That's 350 employees. I want to make that clear. 350 employees, again, non-security, non-medical, non-mental health. So, you know, when you talk about taking that money, if you figure the salary money in 235 vacancies, it's roughly $6.35 million. And if you take that, I'm going to have to spend $9.1 million in overtime. So you lose money. So, I mean, when you start cutting vacancies for a department like corrections, you lose money. So it doesn't make a lot of sense. And that's kind of where we are, guys. You know, like I said, I've been involved with the task force. These numbers, you know, we're still working on it. These numbers don't add up to that 32 million, I can tell you that. I'm still working on cutting day reporting centers, cutting out reentry centers at the local level, everything that we've built on and invest in at the local level that has our prison population down by 5,000 today. And if you take 5,000, multiply it times 2439, times 365, that's $44 million a year we're saving with those investments. Those investments are paying off, and we need to continue to invest, and that's what the task force is about. And obviously, we haven't portrayed that with the appropriation committee. And as the commissioner said, we haven't had an opportunity to talk about this with the committee, and I hope at some point we do have that opportunity to talk to somebody about it. So anyway, thank you very much.
Next is Joey Strickland, Department of Veterans Affairs.
Good afternoon, ladies and gentlemen. I've served as Secretary or Director of Veterans Affairs for our state in different administrations for over 14 years. And this is the leanest that I've ever seen my department operate in. We have just enough people to accomplish our mission of supporting our veterans and their families. Any further cuts would affect our ability to support our veterans and their families, and it would directly impact the quality of life they fought so hard to support. The bottom line, ladies and gentlemen, is that we cannot sustain any additional cuts in the Department of Veterans Affairs. Last year, we gave back to our state over $6 million to help close the budget gap. It was all of the reserve money that we had. There are no excess dollars left anywhere in our department. There is no fat. We're now cutting into the bone. If the additional cut of $147,638 becomes a reality, the department would have no choice but to have an actual layoff of five personnel and close 2 of our state veteran cemeteries completely. Burial of our veterans is critical, and if we could not accomplish that, it would give us a black eye on the national stage. That's how critical it is. Also, should the 2 cemeteries, one at Rayville, Louisiana, and the other at Leesville near Fort Polk, be closed, the state would be obligated to repay grant monies received from the federal VA for the construction of these facilities, which would be in excess of $10 million. This would make the budget crisis even worse and would deprive hundreds of veterans and their families the right to be buried in a state veteran cemetery near their family homes. And we only have 1 national cemetery in our state, which would not be able to meet the capacity that we need. 2 cemeteries have seen the highest number of burials of veterans and their immediate family members recently. The Veteran Cemetery in Keithville near Barksdale Air Force Base buried over 30 folks just recently. The Veteran Cemetery in Slidell buried over 59 veterans and family members also just recently. A veteran whose family could not afford the cost of burial was also laid to rest with the help of donations. Just in the last month, we have buried over 100 veterans and family members. Every day, even as we speak right now, we are burying our veterans and their families with dignity and honor. The loss of these services would affect 340,000 Louisiana veterans. This would not be a good thing for Louisiana. I'm going to be followed by the State Commander of the American Legion, Mr. Rudy Board.
Good afternoon. My name is Rudy Board Sr. I am the commander for the state of Louisiana and its American Legion Group. We are approximately 20,000 strong at this point of the year. But when you stop and think about it, you say, oh, it's only 20,000. Well, we are 20,000 members. However, there are 9 to 10 other major veteran organizations. Altogether, we make up approximately 100,000 veterans that are involved in our communities, involved in our community service as well, helping veterans acquire their benefits, helping veterans to enjoy those last days of their lives due to various illnesses such as cancer, derived from Agent Orange, and other illnesses such as that. Do we want them to go from around the central Louisiana area of Fort Polk, with all the military retirees we have there, who served 20 years plus in many cases, and they retired there because of the VA cemetery being put there, so that families would have a close proximity to their resting place so they could go visit them. I say that the Secretary told you that it's a detriment to the veterans. He is a veteran, and so am I. 21 and a half years, multiple combat tours, and I was fortunate. However, do we want those elderly veterans, their family members, to be buried in a civilian cemetery? I'm speaking on all 340,000 veterans. No, we do not. And I ask that they reconsider the cut. It's not $146,000. When you hear the other departments, they speak about 10, 50, $100 million. It's the sacrifices made by those veterans for you and I, so that we would be secure in our homes, and so that we could go at a final resting place. And I ask that you choose to keep that money in the budget for that. Thank you.
Thank you, Reed. We have two other non-governmental speakers here today. Jan Miller from the Louisiana Budget Project.
Good afternoon, everybody. We're a nonprofit here in Baton Rouge that tries to look at how tax and budget policies impact low and moderate income families. And so I think we need to talk about who is really being affected by these cuts. The United Way put out a report recently that found 42% of households in Louisiana are either living below the poverty line or so close to the poverty line that they are having trouble making ends meet on a day-to-day, week-to-week basis. That's who's being affected by these cuts. There are some who would say that spending in government is out of control. The facts tell a different story. Spending is not out of control in Louisiana. The state general fund next year is lower than it was 10 years ago, and that is without adjusting for inflation. When you look at total state effort, the general fund and the money we raise through fees and self-generated revenues, it has grown less than 0.5% average rate over the past 11 years. That again is lower than the rate of inflation. Spending is not out of control. These cuts may look like they're coming out of a $30 billion budget, but they are really coming out of a discretionary general fund budget that is much smaller. It's about $3.5 billion. So when you look at the context of $235 million out of that, that is a very big cut. And a reminder, almost 90% of the money in the discretionary general fund goes to health care, education, and human services. These are services that 42% of Louisiana families that are extremely vulnerable depend on. These cuts are entirely unnecessary. You know, it's one thing for the Appropriations Committee to say, we're going to take money out of this priority and move it over to a different priority. But what happened yesterday is something very different. They said, we are going to leave $237 million in the bank instead of spending it on people in need. These cuts ignore the fact that certain mandated costs go up every year, whether we like it or not. That includes things like the cost of state retirement, the cost of providing health care to state employees, things that we have no choice but to fund. So when we look at it in this context, a standstill budget is in fact a budget that cuts. And finally, these cuts are extremely damaging because of all the cuts that have come before it. This is not the first rodeo for state employees and state services. They have been cut repeatedly. We've had streamlining commissions. We've had consultants come in. We have cut in every corner of state government. So to view these cuts in isolation as a one-year event would be a mistake. And so I think the real answer here for the legislature is to look not at where we can keep cutting the budget, but how we can reform the broken tax structure. The reason we're back here year after year looking at cutting the budget, hurting vulnerable families, is because we refuse to look at the other side of the ledger and how we can repair a tax structure in Louisiana that is badly broken and badly in need of reform.
Thank you, Jan. And then finally, to address a topic we haven't mentioned yet, Scott Richard of the Louisiana School Board Association.
Thank you, Commissioner Dardenne. Scott Richard, representing the 69 locally elected school boards in our great state of Louisiana. Before I drill down into the proposed cuts to K-12, what often goes unnoticed in the debate over budget issues is that the very topics Secretary G and Secretary Walters discussed about cuts to our most at-risk students in the state of Louisiana, coupled with the multiplier effect of lost federal dollars that are targeted to help those at-risk students that attend school in our schools across the state, get lost in the discussion. We need those dollars to make sure those students, those most at-risk students, are being served. And it's a detriment to providing a high-quality public education for our students, which is what we strive to do. In regards to the cuts that are targeted for K-12, the language is vague, unclear, and certainly does not represent the standstill budget that was projected earlier in earlier discussions. The amendments appear to remove about $18 million from K-12 education. We believe that these cuts would focus on areas of funding that target our high-cost special needs students that cost 3 times the normal cost to educate in Louisiana, and those cuts would also target supplemental course allocations, which is an initiative designed to prepare our students for the workforce here in Louisiana. This would be on top of reductions in state funding of about $24 million for this current year and a projected $38 million hit due to increased state retirement obligations that get passed on to local school districts. This certainly would present a negative impact to all of our classrooms across the state of Louisiana, and we hope to work with the administration and work with the body, the legislature, to reverse these cuts and make sure K-12 is a priority moving forward. Thank you.
Thank you, Scott. All right, on these happy notes, we'll be happy to try and take any questions that you have. Answered everything? Good.
Dr. B, can you be a little bit more specific? I'm not familiar with what behavioral health programs OBH provides. So when you say eliminating behavioral health, can you give me an idea of what?
Sure. So one on the list that has been discussed in depth previously is the psychosocial rehab program for youth. That's over 40,000 children with behavioral health disorders throughout the state to develop social and interpersonal skills, to increase their ability to be in communities, hold jobs, and have daily living skills. So that is an important program. The UPL, FMP, and UCC DISH program helps 120 psychiatric beds stay open. So these are the beds. The state is already sorely lacking in resources for inpatient behavioral health services. So that would be the elimination of 120 beds, which would have an impact throughout the state. The elimination of the specialized behavioral health program. These are services that are delivered by a psychologist, psychiatrist, licensed mental health professional, and there are about 135,000 Medicaid recipients who have a mental health issue who have services through this program. And just to stress that in my department, every dollar we spend of state general fund, we get $3 back. So every dollar you cut from LDH is a $4 cut to the state's economy of the state. So for example, for the specialized behavioral health program, it would be a $29 million cut, but an $81 million hit to the state. And it's just because of the gruesomeness of these numbers. You know, $750 million in total, which includes the state, the federal funds of $500 million. You have to cut real programs. There's no fluff that adds up to that number. So you're talking about cutting services to the most vulnerable families in this state, and you're talking about making penny-wise, pound-foolish decisions that we need to get away from. One of the reasons we're the incarceration capital of this nation is because we don't take care of our people's behavioral health needs. And the last thing we should be doing right now is cutting behavioral health services. We need to be augmenting them. Of course, the medications is also an important piece of behavioral health that I discussed. So if we feel it's the prudent thing to pay the check payment. We can't keep kicking that can down the road. But if we do pay that, we have to eliminate adult pharmacy. And adult pharmacy includes antipsychotics, antidepressants, things that keep people from being psychotic, committing suicide. They keep individuals and families stable. So not having access to medications is obviously a very important component of psychiatric care.
Dr. D, along those lines, I know that y'all have already tried to eliminate the psychosocial program. In several hearings, you brought up the pediatric daycare centers. I guess, can you speak a little bit to some of the hurdles that you found as you have tried to eliminate them?
So, and I would stress, we don't want to cut any of these programs. We feel that all of these programs are important. Some of them may need reform, and that's prudent, and we always need to look at our programs and are they running efficiently and effectively, are they serving the needs appropriately. But elimination is not our preference, but when the legislature gives us a large amount, and as they did in the House yesterday, tell us, well, you can't cut partners, you can't cut GME, you can't cut, and we already can't cut managed care more because we're already at the absolute minimum, we can fund that. You can't then have buckets that large that will not eliminate programs. So in the last iteration of this process, we put a program on the list for cut, and then the legislature told us we can't cut it. So they really hamstring our ability. On the one hand, they don't fund us adequately to pay for the programs we have, and on the other hand, they don't want to take a stand and have the courage to say, well, here's where I would cut, Secretary. These are the programs we don't want to pay for. So they abdicate their responsibility while trying to make us look like the bad guy, but we can only spend the money that we're appropriated. And if I don't have enough money, and I get a $750 million cut, that will cut services, and it will cut services that will impact all the people of this state.
I'm kind of curious, it seems like we keep hearing a lot from particularly the leaders on the House Appropriations Committee. They feel like somehow they don't have enough information to where this large budget is all going. There were a lot of questions about different aspects of the budget. I guess, do you feel like there's a need to work with them to try to go through, I guess, their concerns about how the money is being spent on LPH?
Well, I have spent hours, and that's what is really frustrating to me is that, as Secretary Walters said, none of us were asked about the implication of these cuts, whether these were advisable cuts, what would be, in our opinion, as the subject matter experts running our department, a way to cut. These were just done, and they were done haphazardly with amendments about what you can, in my case, major programs I can't cut, that then forced me to cut other programs. I spent over 6 hours just over the past few weeks discussing the fact that our budget is large, but big is not bad. Big means we are providing services for everyone in the state of Louisiana. Most Medicaid programs, most state health budgets are about half the state budget. That is true for our state. Health is a priority. We're in charge of the health and safety, public health safety of every individual in this state. And so, I don't know that it's for lack of information, because we certainly have shared, and I've offered to meet with any legislator in their office, go over the numbers, educate them. We have spent countless hours discussing the issue of fraud, waste, and abuse, which Louisiana continuously ranks in the highest of the nation in its best ability to have low fraud rates, low error rates, and high recovery. So I think that they want it's a sacrificial lamb idea that they would like to have a large program that wouldn't impact anyone that we can cut. And the reality is that the program just does not exist.
Okay. Have you looked at higher education in this realm?
What do you mean if we looked at it? It's been subject to the 2% cut proposed by the governor, which we reluctantly wanted to do because, as you know, last year was the first time that we didn't decimate higher education. But in these cuts, higher education was not cut by the Appropriations Committee. So the budget as it's presented by the governor stands with a 2% cut to higher ed.
Another question for Dr. B. If they had not cut you further to fully fund TOPS, is there a way, and I don't know if you can do this, to parse out what you might have been able to preserve if they had not taken the extra $82 million?
So I don't want to do, I'm happy to talk with you after the fact about that, but I don't want to give you numbers off the top of my head, but certainly that additional $82 million was a huge hit to the department, because again, $82 million multiplied that by 4, that's that much additional money that we have to take out of programs.
I also am a little bit confused about hospitals, and maybe I didn't understand what was happening yesterday. So you're not allowed to have partners.
Any more than was the 6.2% that was proposed.
6.2.
Right, and we're not allowed to cut them differentially, so we have to cut them all the same. So for example, if we wanted to prioritize GME where the medical schools are, we couldn't do that. So it forces our hand in terms of that. The 2 large supplemental programs are the partners and the waiver services, and both of those were on the don't cut list.
I seem to remember during the special session that when they said y'all couldn't cut partners, that was going to result in cuts to not hospitals that are not partners. Is that also something that would be happening under this scenario?
One of the things that we've proposed, and Commissioner and I have talked about this a lot, is money follows the patient, is that with Medicaid expansion, we have there are new pathways for access to care throughout the state, and people are walking with their feet and going to other facilities. So we had proposed a reinvestment in hospital rates that would have resulted in an increased amount of money, overall money, to go to hospitals because of the increased federal match that would have come with that. So cutting our budget this substantially does not allow us to do that. It doesn't allow us to really right-size some of the supplemental payment issues we have.
All right, one last question.
Commissioner Dardenne, if you don't mind, I'd like to kind of shift gears before y'all leave. We were all awaiting a decision from DOJ today as rumors circulate about the Alvin Sterling case. Has the administration received any sort of information as to when that decision might come down?
No, ma'am.
Commissioner, can I ask you though, it's a topic that's been on the minds of people across Baton Rouge, across the state, and now getting national attention again this morning, and likely about to explode into national attention with an article the Washington Post just broke. But I want to ask you personally, have you felt like the state's been kept in limbo for the last 10 months?
This is a process, obviously, and the Department of Justice has to go through its process, and they've done that, and I know I have not been personally involved in the discussions, but the administration has certainly been involved with the Department of Justice and those involved in this decision, along with the mayor-president, as to what's going on. We've not been told when a decision will be forthcoming. Obviously, there's been some talk about it being imminent, and it may very well be, but we do not know when it'll happen, and I think the state and the city parish has done what it needs to do to communicate with the department to make sure that we're informed as soon as they're ready to make a decision.
All right, thank you all very much. Thank you.